The evolution of this is amazing. In the last 10 years, we have gone from making a big incision like that to a little pinhole like that, and having people be on the golf course in 2 weeks rather than 2 years. Sports medicine is now a discipline based on microsurgery or arthroscopic surgery of now any joint, practically. And it is mostly for athletes, but the same techniques can be used for recreational athlete, older people, etc. The surgical techniques are the same. I don't all of a sudden put on my Superman cape and become a different surgeon when I operate on a professional athlete. So the same shoulder surgery that I'm going to do on a 20-year-old volleyball player is the same surgery I'm going to do on an elite athlete playing in the NBA. That being said, the stakes are a bit higher, and you're talking about a person's livelihood, and you're integral to whether that person actually performs again at the same level. If I get a professional athlete and he's not 100% the way he was, if he's 6% less, he ain't playing in the NHL anymore. He's done. So dancers and professional athletes and people who's have to stop on a dime and do things that us humans, mere mortals can't do, they have to be perfect. So you may do something that maybe you wouldn't do on a normal person. Stretch it a little bit, maybe indicate something a little bit more. Outcomes being as good, momentarily they might be, but you may in a certain way rob Peter to pay Paul. So you might do something to extend a career anywhere from 3 to 5 years or whatever, but the flip side is the liability of that in the future may come, and it may be not so good. A lot of 35-year-old recreational athletes, if you explain to them in those terms, they'll take that shot as well. So it's not just reserved for the elite athlete, but when I approach somebody and I make sure that I educate them in such a way in layman's terms, so that the decision that they make is one from knowledge rather than from being pushed or bullied. And I would never let anybody leave my office or enter an operating suite without that knowledge. 3 things excite me: stem cells, stem cells, and stem cells. Did I say stem cells? I think I did. The reason is because that is the future. It's actually kind of the here and now. We're knocking on the door's slightly opening. I would have liked to have had a little more traction, so to speak, because I've been involved with this for 20 years. If, give an example, I see a person that has what we call a chondral defect. A chondral defect, for all intents and purposes, is like a rotten spot on an apple. Okay, the apple's smooth and there's one spot that's rotten. When you have that on a bone and it's in a weight-bearing position, it causes pain. Not only does it cause pain, but eventually that area starts from small and gets big and then very big, and that's what arthritis is, and that's why you need a knee replacement. What if you could arrest that? What if you could somehow take a core from a nice fresh apple and put it in the place of the one that has a spot? Or what if you could actually somehow take some cells that are billions of your own cells or the patient's cells, program them, and have them grow new cartilage? Well, you might have made that person not need a knee replacement. And not only does it help the patient, but in terms of where the health dollars go, it's again, ounce of prevention, pound of cure. That's where the future is.